Emma, hello Emma. You say you've been trying for 5 years and can't afford IVF.
No, basically, we've been trying on and off. We've both got fertility problems. I've got polycystic ovary syndrome. My partner's got low sperm count. We've had miscarriages, and because of this, we're not entitled to IVF on the NHS.
Is that true? Is that right?
Yes, depending on when the time of miscarriage was, but yes, it can be. The sad thing about entitlements on the NHS is that they're very locally driven by the local clinical commissioning group, or CCG.
Gosh, that seems like you're being punished twice.
Yes, the rules can vary completely depending on where you live across the country. As you may have heard, it's a postcode lottery at the moment.
So with those two medical conditions working against them, is there anything that they can do?
Yeah. There are things that you can do, Emma. So with regards to the sperm issue problem, I think we've addressed some of those issues already here. The other one that perhaps should have been mentioned is exercise is really important. So not overdoing it, but making sure that you are getting some exercise.
Healthy food, healthy diet.
Exactly, exactly. All those things are very important. With regards to your PCOS, Emma, how regularly are you having periods?
I actually have them every month, and I always have.
Right. OK, so that's really good. It's really important that you menstruate regularly in terms of your ability to get pregnant and also in terms of your womb health. But again, there are some lifestyle changes that you can make that help in particular with PCOS. So things such as improving your diet, in particular trying to eat more organic produce, which is lower in animal and synthetic hormones that can impair hormonal balances, which is a particular problem in PCOS that essentially is due to hormonal imbalances. And then there's other things such as reducing the amount of dairy that you consume, again, because a lot of the dairy that we do have, especially milk, may contain hormones, which may again interfere with your ability to get pregnant. And then taking supplements, so really important that you're on folic acid every day whilst you're trying to get pregnant, and then into the early parts of your pregnancy if you succeed. And then taking a combination of multivitamins, B, C, D and E, and omega-3s, also really important.
It's funny, we had, a long time ago we had Professor Robert Winston on here, and thankfully, you know, we've done this similar thing with him a number of times. And I can remember him, I think it was a phone-in or something like that, that someone was having trouble conceiving, and he was very basic and said, well, how many times are you having sex? And they said, well, actually, you know, sort of much. He said, well, no, he said, you'd be amazed how many times it's down to the amount of attempts.
Absolutely, and, you know, really valid point as well to address the number of times that you are having intercourse.
How often, if you're trying for a baby, how often should you be having sex?
2 to 3 times a week, we recommend, but trying to optimise that around the time of ovulation.
Yeah.
So in the week leading up to ovulation, on the day of ovulation, and then up to 2 days after, really important to have sex because sperm can hang around and live in there for a while.
Thank you very much.
All right, thank you.